Hi guys, this is Dr. Kavita. NEET UG results are out, and if you're someone who is planning to become a doctor, you know someone who wants to become a doctor, or you just gave the exam and didn't get the desired results, then this video is for you. And I bet you will find it really useful if you watch it till the end. This is Dr. Kavita. I'm a radiation oncologist and I gave my MPS entrance exam more than 12 years back and failed. Yeah, on my very first attempt, I failed. And it feels like the end of life. I know you associate the exam with your failure and all those things, but this video is not for motivating you to keep on working hard and do the hustle and try again and become a doctor eventually. But in this video I will tell you to really ask yourself, why do you want to become a doctor? So many lakhs of students every year in India give the NEET exam, and only 10 to 20% of them end up becoming doctors. And even if you do the residency, even the cutthroat competition is high even in that stage. So you just don't need to think about at this stage how do you feel, but how do you want your life to be in the coming 10-20 years. Yes, if you don't think it through, even if you become a doctor, you will become a frustrated one, and you might even end up leaving your stream. I have seen many students who end up leaving the whole medicine profession because they don't feel motivated or inspired enough to do their work. So number one question is, what is the main reason that you want to become a doctor? And the answer is not simple. Like, if you say I want to help people, then do you think there are other careers in which you can help people staying in the medical profession, like being a nurse and being a dietitian, being a physiotherapist, being a counselor, being a psychologist, being a cancer caregiver, and the list goes on. Now, I'm not saying you that you are a failure and you gotta get out of the race and look at other options. No. What I'm saying is, how highly motivated are you for just the doctor life? Now, when I talk about the doctor life, it is not all that is shown on Instagram or YouTube, where people see only the highlights, but the real struggle is studying for 10 to 12 hours per day, especially during the exam season, and the high level of stress, and getting no time to eat food literally, and not being able to attend family functions for years, and not having a decent social life, at least till you become established doctor. And the stress, it's real. So these are the things that you need to keep into account before deciding that do you want the good parts of it or all parts of it. Because I know the good part is entering the OD, the smell of OD, seeing the smile of a child that you just treated, and seeing somebody give birth to a life, and treating a wound, and operating on a patients, and seeing your patients thanking you. Yes, if these things overpower all the things that I told you, the struggles that a doctor needs to go through, and one thing that I will add to that struggle is thanklessness of today's generation for the doctors, as it is no more a very respectable profession, sorry to say, in India. So yeah, you also have to be ready for that. So if these are not very important to you, or you're okay bearing these struggles, and you really want that high and that happiness of being a doctor, then yes, go for it, my friend. drop another year, and how many years it may take that, just like it took me years of preparation in becoming a radiation oncologist like I am today. So yeah, become that. But if not, and you still want to help people, you still want to be part of the healthcare family, then there are plenty of options that you can go for. And the number of study hours and the complicated study techniques and the curriculum associated with the medical profession, it is not necessarily in the other professions which are included in the healthcare. So you get feeling of both worlds, that you stay to be part of the healthcare community, and yet you got to have your social life, as well. And now I'm not saying that you can't have a social life, but yeah, in the initial years it is going to be grilling. Now, what's the second question? So the second question that you need to ask is, and this is a really important one: under huge amount of stress, will you be able to carry out all your functions well, especially during exam time? Stress usually is one thing, but stress during MBBS exams, each prof exam, like each 6 months, and the other test is totally different, and no one warns us about it, and people really, really go into anxiety and panic attack, and they don't even feel confident enough to take, guidance for that. So you got to be really mentally really stable, and I think stable is the wrong word, but like really strong, and you should be able to consult mental help when needed, because so many of medicos end up sadly going in depression, anxiety and panic attacks due to the stress that we get to face. And I would not want you to go through these phases and then end up regretting your decision. So before deciding, you need to keep these factors in your mind. And anyways, I dropped for 1 year and ended up in the college, but in the first year I failed anatomy again, and there it was, the huge stress and the huge imposter syndrome that ended up waiting for me, that I'm not good enough and all those things. But here I am telling you that even after multiple series of failure, you can become a doctor, but you just need to ask yourself, do you really want to? And if the answer is yes, then go ahead and prepare and plan new strategy, talk to the seniors, talk to people who fail multiple times before becoming a doctor, and try to adapt to those strategies and choose the one that suits you the most. So it is not about feeling a failure when you fail, but it is just about learning that lesson, that yes, okay, I failed, now what can I do? You can cry for 1 day, 2 day, 3 days, but that's okay. I mean, what after that? So this one is just for those people who are feeling disheartened after the results. But I bet if you end up becoming a doctor, you will become a great one. Till the next time, Dr. Kavita signing off. Good luck and take care.